Everyone deserves to have an endocrinologist to fully understand all of the amazing metabolic processes that our bodies are performing. I'm Dr. Lindsey VanDyke, and this is the Endo Days. Thank you for joining me on the Endo Days. Today, we will be reviewing a new topic that I've been seeing with increasing frequency, polyglandular syndrome. Well, what is that anyway? There are two types of polyglandular syndrome. One of them is a rare inherited disease, and the other can happen to those patients who already have an endocrine problem that is caused by antibodies, like type 1 diabetes or Hashimoto's thyroiditis. First, let's talk about the type 2 polyglandular syndrome, because this is far more common. Just like the name itself, polyglandular, this means many glands are affected. In the old days, we called it Schmidt syndrome, and the most famous Schmidt syndrome patient was John F. Kennedy, who suffered from adrenal insufficiency and thyroid problems. It also happens that type 2 polyglandular syndrome affects women 3 times more often than men. It seems to occur in families, but we have not been able to identify how exactly it is inherited, because there are many genes involved, and how those genes interact with the environment also matters. There are many types of endocrine dysfunction that can be included in the diagnosis, and a polyglandular syndrome is diagnosed when a patient has at least 2 of the autoimmune endocrine problems. Because there are so many associations, let's talk about the combinations that are most common. Over 50% of these patients have type 1 diabetes. That means you require insulin because you cannot make insulin anymore. Up to 70% of patients can have an autoimmune thyroid disease, and that could either be Hashimoto's thyroiditis or hypothyroidism, or Graves' disease, an autoimmune type of hyperthyroidism. Adrenal insufficiency, while quite serious, is pretty variable. It can happen at the same time as the other diseases. It can be delayed for several years or even more than a decade, or it could never happen at all. So when we see these other endocrine diagnoses with autoimmune causes, we stay vigilant for those classic signs of autoimmune adrenal insufficiency that will tell us when a patient needs to be tested and treated. Celiac disease does occur in 1 to 2% of the patients who have type 1 diabetes, so I'm careful to screen all of my type 1s for celiac disease. Some of the other diagnoses that can constitute a polyglandular syndrome are hypogonadism, which would manifest either as an inability to conceive, or in the case of women, early menopause, or in the case of men, it could cause erectile dysfunction. Some patients will have hair loss, which is called alopecia, a type of anemia that's called pernicious anemia, skin changes that are called vitiligo, and myasthenia gravis, which affects how our muscles contract. Okay, so that was type 2 polyglandular syndrome, and as I said, I'm seeing this more frequently now, so it's worth being aware. Now let's go to type 1. Type 1 is quite rare, and it's caused by mutations in the AIRE gene on chromosome 21. It's inherited in a recessive pattern rather than a dominant pattern. That means a patient has to have 2 mutated copies of that recessive gene in order for the disease to show up. So let's think of an example. Let's say mom and dad both have 1 copy of this mutated recessive gene. They don't have the disease because the other copy they have is normal and dominant. So each time they decide to have a child, each parent is going to give 1 of those genes each, and that's a random process, to this upcoming child. When we map these genetic inheritance patterns out, each birth of a child has a 1 in 4 risk of receiving both recessive mutations and showing signs of that disease. It also is most common among the Finnish, Norwegian, Iranian Jewish, and Sardinian populations. There are conflicting reports about whether or not type 1 polyglandular syndrome affects women more than men. So what does the disease look like? Well, it has a long and complicated name that gives us hints to the symptoms that the patient will have. The name is Autoimmune Polyendocrinopathy Candidiasis Ectodermal Dystrophy. That's a mouthful, so we call it APECED for short. All right, so let's unpack all of these things. Let's go through autoimmune polyendocrinopathy first. That AIRE gene that we talked of before affects formation of the adrenal glands and the pancreas, as well as the thymus, and that's important. The thymus is a powerhouse of the immune system early in life, when we're infants. We think, though we are not totally sure, that the mutation affects how our immune cells in the thymus function. Those immune cells are also called the T cells, and maybe it makes them go haywire and attack these other glandular tissues that otherwise we try to protect. The most common endocrine problems these patients have is hypoparathyroidism, which affects the bones, adrenal insufficiency, which can be quite dangerous for a patient, and hypogonadism. The hypogonadism can show up either as a failure to go through puberty or an inability to conceive later. The timelines for these things do vary from person to person. Let's talk about this candidiasis. So candidiasis is a fancy word for yeast infection. One of the most common ways a patient can demonstrate he or she has this disease is with these chronic yeast infections of the mouth or other what we call mucosal tissues. Those mucosal tissues can include the nail beds, eyelids, all of the GI tract, but most specifically the esophagus, and even the nasal passages as well. This starts to happen early in life and can be resistant to the usual treatments for yeast infections, which raises that red flag that something else is going on. Ectodermal dystrophy. Okay, so ectoderm means an outer layer of tissue. We usually talk about ectoderm when we talk about how embryos develop. So in this syndrome, these ectoderm dystrophies or malformations are described as occurring in the enamel in our teeth, finger and toenails, and finally even our eardrum can calcify. What the name doesn't hint at are some of the other autoimmune symptoms patients can show. Sometimes they may have vitiligo, or as we previously mentioned, this affects the skin. These are whitened patches of the skin. This is what Michael Jackson suffered from, though his case was quite severe. Most commonly, when I see vitiligo, it's really just in the hands and feet, sometimes in the arms or legs, sometimes the torso, and more rarely the face. Sometimes a patient can develop a type of anemia called pernicious anemia, which we previously referred to. Hair loss, which we also referred to earlier as alopecia. However, type 1 diabetes is fairly rare in this type of polyglandular syndrome. All right, so today we reviewed two very different syndromes that also share a handful of similarities. As always, I maintain that a patient is his or her best advocate, and if things aren't going as expected with endocrine treatments, or something just isn't making sense, getting in touch with an endocrinologist may uncover the key to your health. There is, in fact, a third type of polyglandular syndrome, but I'm not going to review it in detail because the only real difference is that it does not affect the adrenal glands. If you want to read more about polyglandular syndromes, it can be difficult to find a reliable source. To start, check out medscape.com and search for the keyword polyglandular. It will give you more details about the three types of polyglandular syndrome in an easy-to-digest but accurate format. Thank you for tuning in for today's podcast. If you like learning from the Endo days, please subscribe. And as always, you can view these podcasts on the YouTube channel with closed captioning. Until next time, be well.